to Wellness Unlocked, your guide to health, happiness, and everything in between. My name is Dr. Toby from Quincy Wellness. Okay, so today we're going to be talking about the top leading causes of death, and this is leading to the final one we're going to be talking about today, and that is diabetes. Yes, diabetes is a leading cause of death. Okay, so fun fact about diabetes in Nigeria. A lot of people don't know that diabetes is actually a top problem that we're facing in Nigeria. Guess what? Over 12 million people live with diabetes in Nigeria today, and at least 50% of those people do not even know they have diabetes. Okay, so what is diabetes? Diabetes comes in three different parts. We have different types of diabetes. We have diabetes insipidus, we have diabetes type 1, we have diabetes type 2, and then we have gestational diabetes, which is the diabetes you get when you're pregnant. But today we're going to be talking about diabetes type 2. So the reason why we're going to be talking about diabetes type 2 is unlike the other types of diabetes, well, minus gestational diabetes, diabetes type 2 is actually a disease of lifestyle, meaning you can acquire diabetes due to how you eat and your lifestyle, how you live, what you do with your life. In diabetes type 2, it affects the way your body regulates sugar and also affects the way your pancreas creates or disperses insulin. So there are two things involved: the way your body regulates and uses the sugar, and then also the amount of insulin, which is something your pancreas, which is found in your abdominal cavity, helps to, process the sugar. So let me just break it down. So with diabetes type 2, your cells in your muscle, in your fat, and in the liver become resistant to insulin. Additionally, the cells cannot take up the sugar properly, and also the insulin your body produces, your pancreas produces, also reduces. So there's just a lot of free sugar just running around through your body. So I'm going to talk about what are the risk factors to developing diabetes type 2. So one major risk factor to developing diabetes type 2 is being overweight or being obese. And that is because you have more fat cells running around. I remember what we said earlier. The cells in your muscle, in your liver, and your fat cells become resistant to insulin. So when you have more fat cells, just in general, then there's more cells involved to become resistant to insulin. And that is why being obese or being overweight is one of the main reasons for developing type 2 diabetes. So other risk factors for developing type 2 diabetes include being 45 and over. However, we're seeing younger people, even in their 20s and in their teens, developing type 2 diabetes. Having a family history. So if your dad or your mom or your cousin or your grandmother, your uncle has diabetes, you have a higher risk of developing diabetes. Another thing is having not taking enough exercise, not being physically active, just sitting on this desk all day, every day in the name of work. And then one more risk factor is actually smoking. So smoking increases your risk of developing type 2 diabetes. There are many other risk factors, but those are the ones that I feel are very important and is something that all of us can relate with. Oh, one more. If you had a baby that was big, so over 9 pounds, or you were diagnosed with something called gestational diabetes, which is diabetes while you're pregnant, you also have a higher risk of developing type 2 diabetes. So what are the symptoms of diabetes type 2? In general, with many symptoms of other kinds of diabetes, the main symptoms are having increased thirst, meaning always wanting to drink water, increased hunger, increased fatigue, blurred vision. I'm sure a lot of us have thought, oh my goodness, I've had this issue happen to me all the time. Do I have diabetes? Well, yes, you need to definitely check to be sure you don't have diabetes. But if you're having these symptoms, another one symptom is when people say, oh, I have low blood sugar. So that low blood sugar is a sign that your body is not regulating its sugar levels well. And that also means you have a higher risk of developing diabetes. Okay, so what are the side effects of diabetes? What are the long-term, short-term side effects of diabetes? One of the major effects of diabetes is that it actually damages your organs slowly over time. And you get these things where I call pathies. So neuropathy, retinopathy. Long story, it is something affecting your eyes. It affects your eyes. It affects your kidneys. It affects even the circulation in your body. So that puts you at risk, because when you have low circulation in your body, it means your hands and your feet don't get enough circulation. And that can lead to poor wound healing. And when you have poor wound healing and you have just a little cut, it doesn't heal well and it can turn to a big thing. And that's what makes many diabetics to develop something where we call it gangrene, and they have to amputate it. So it affects your eyes, your kidney, your liver, your blood vessels, and then it also affects your nerves. And that's what they call neuropathy. So all these pathies, I call it PHTHY pathies. When it affects your nerves and it damages the nerve cells, you start having tingling, numbness, and pain in your hands, in your feet, and even in your joints. So in case you're freaking out, oh my goodness, I think I have diabetes, or am I at risk? I'm having these headaches, I'm having blurred vision, I'm having fatigue, I'm feeling hungry, I'm feeling thirsty. Just calm down. There's one way you can check, and that is by checking your blood. I always tell people, do not self-diagnose, because one thing can mean many things, or it can mean nothing at all. So the best way to diagnose is to do a blood test to check your sugar levels. And not just any blood test, because a lot of us do this, the random sugar blood test where they take it from your finger, or they do a fasting blood test. That just checks what your sugar level is now. It is not the best test to determine if you have or are at risk of developing diabetes. The best way to check if you have diabetes is to do a test called glycolated hemoglobin test. So it's called the HbA1c. That determines how much sugar has been in your body. It determines your sugar level over the past 3 months. So you cannot cheat on that one. You can starve ahead of time for your normal blood sugar test tomorrow. But you see that one of 3 months, you cannot fake it. So you check to see what your blood sugar has been over the past 3 months, and that is the best test to determine if you have diabetes. And there are parameters to determine, okay, if it's above this amount, you're pre-diabetic. If it's above that amount, you're fully diabetic. And if it's below this amount, you're fine. So the best way is to do that HbA1c test. And it's very simple, it's affordable, and you should do it at least every year if you're at low risk. And if you do have diabetes, it's something you should be doing at least the first time you're diagnosed with it, you do it every 3 months. And then once you are managing it, you do it every 6 months. Okay, so now let's say you've been diagnosed with diabetes. What do you do? What's the next thing to do? Is it reversible? Can you stop it in its tracks? How do you now start to live your life? That is where it comes to managing diabetes. And it's something that is not the easiest to do, because unlike other people that can eat all the rice they want, drink all the soft drinks they want, take all the fruits they want, your body cannot process those things properly like everybody else. So you now have to start to look at what you're eating and make sure that you're doing more plants, less everything else. So I always say a plant-based diet is the best way to, first thing, if you're early or newly diagnosed with diabetes, you can reverse it. And if you do have diabetes, you can reduce your HbA1c levels and reduce your risk of developing the pathies that can damage your organs and things like that. Then the last most important thing is to exercise. And I don't mean going to the gym and start to sweat in the gym for 10 hours. No, I'm not talking about that. I'm meaning just something as simple as walking for 30 minutes a day. taking a small jog for 30 minutes a day, or even just doing chores around the house for 30 minutes a day. Just making sure you're consistent in it. Because if you go to the gym, oh, you said I have diabetes, let me start lifting weights, doing this, you're going to burn out really quick, and you cannot sustain that 4 hours a day. But you can sustain 30 minutes a day. And even if you're not diabetic, and you know somebody in your family that is diabetic, or even if nobody in your family is diabetic and you're overweight, those are things you should do. Everything I've mentioned above are things you should do to help reduce your risk, to help manage the diabetes if you do have it, and to even reverse diabetes if it's diagnosed early. So it's very important to do diet control. I don't mean go on a diet, but a lifestyle change. It's a lifestyle disease, and the way to treat it is to do a lifestyle change. So not saying, oh, I'm going to just do fruits for a whole year. I'm going to do just juice for a whole month. I'm going to just do just salads for the rest of my life. No, it's not sustainable. It's something that you must sit down with a professional who knows how to treat diabetes, and you have to sit down with your family members, sit down with your friends, and start to do what they call meal planning. And it's very important that you try as much as possible to eat as much fiber as possible, because eating fiber will help to reduce, number one, your sugar cravings and your hunger cravings, because it keeps you more full. And you get that in, when Nigerian, you get that in the 4 vegetables, you get that in, even something as simple as some tubers like carrots and things like green peas and lower starch content tubers. Those are things you can actually eat that can keep you full, keep you staying full, and reduce and helps to regulate the blood sugar in your body. Then another thing is when people talk about fruits, oh, can a diabetic eat fruits? Yes and no. So at the end of the day, the bottom line is sugar, glucose. All the fruits and the vegetables and the starch and the rice, it all boils down to glucose, which your body cannot handle very well. So when you're thinking about fruits, you have to think of low sugar fruits. And where do you find low sugar fruits? You find it in avocados, you find it in watermelon, you find it in pawpaw. Those are where you find the fruits. The second thing you need to worry about is portion control. It's a big deal. I'm not going to say don't eat rice or don't eat yam or don't eat beans, but you should always think of having small portions of that. And you think, oh my goodness, I'm just going to eat this small, diabetic rice or whatever it is that they call it. How am I going to sustain myself? That is why I talk about eating the plants that has the fiber that will keep you full. So your plate should be 50% plants, and then 25% your starch or your carbohydrates, and then the other 25% should be your protein. So your eggs, your lean meats, your chicken, your fish, and things like that. And then finally, you top it down with water. Water is good because it dilutes the sugar in your blood. It helps to keep you hydrated. It helps to keep you full, which also reduces your cravings for sweet or sugary things. So what are the medications or the treatment options when you have diabetes? So we do have medications that are anti-diabetic medications like metformin, other medications, but the main one everybody uses is metformin. And those are medications that help to regulate the sugar for you. Now we have a lot of herbal remedies that help to also keep your sugar levels controlled. And I'll just give you one for free. You know this drink that we drink, what's the name? Zobo. Yes. Zobo is a very, very good anti-diabetic. It helps to reduce blood pressure. However, you cannot drink it with sugar. So if you're drinking Zobo, just boil it with the cloves, with the garlic, with the ginger, and just take out the fruits, the dates, the pineapple, everything. Just take everything out and drink it as your medicine. And a cup once or twice a day is enough to actually help to regulate your sugar levels, even if you're not diabetic. Now, if you're diabetic, you should always have a medical professional managing your sugar levels, because we do have some dangerous levels of sugar We do have people that can fall sick from having diabetes, and we even have people that can possibly die from having diabetes if it's not controlled or managed properly. Meaning, if you're taking these medications on your own, your blood sugar can drop to the point that it's not sustainable with life, or you may not be controlled enough whereby you need more medication or more diet or more whatever it is. Those are things you should always discuss with your medical professional so that you're eating right, taking the right medication, doing the right exercise, drinking as much water as you can, and doing the best you can do to stay healthy and either prevent, reduce, or manage diabetes. So that's it, guys, for today for diabetes. If you have any questions or comments, just leave something down below, and you can always contact us on our numbers. You can reach us by email, you can reach us by Instagram or Facebook, and we'll be very, very happy to assist you. Until later, have a wonderful week. Love you. Bye.